it's not just my mom that you guys have helped. It's also me, the caregiver, the primary caregiver. If I didn't get those help from your support system, I don't think I would have lasted that long. My mom, she was actually hospitalized because she had these symptoms of having difficulty breathing, and her blood pressure is unstable. At the same time, she's very anxious. Apparently, at that time, she was already having congestive heart failure. First time I took her to the hospital, she almost fell on me, but we managed to get there.
When I first met this patient was well supported by her family. She has a group of wonderful daughters and family members that were supporting her at home. This patient had congestive heart failure and interstitial lung disease, and both of those diseases can result in frequent worsenings or exacerbations. It was quite difficult for her because she was mostly like bed and wheelchair bound. She was able to walk with a walker, but it was really hard for her to go out to get the chronic care that she needed.
It's a big challenge, you know, and every time I have to take her, I have to take her to the hospital through ambulance. Even if I have help, I always hire someone to come to us and help us to take her to the hospital. I still have to spend a lot of money to do that.
What our team was able to do was firstly offer care in the home and work with the Ontario Health at Home nurses that were already providing her care. Every time she did have some symptoms of an exacerbation, we were able to deliver her timely care to address that with the help of nursing as well as York Region community paramedics. So sometimes we were able to go the same day or next day to assess her and come up with a care plan to prevent her from going to hospital and make sure that her symptoms were well managed.
When the hospital discharged her and offered her some help at home by having a doctor visiting her when it's necessary.
The other thing we were able to do in collaboration with Oak Valley Health and Markham Stouffville Hospital is for her to go for outpatient testing in a way that was easier for the family. We tried to work with Scope to arrange all her tests and appointments on the same day so that she could do all those tests and get all that management in one day.
She said, we're so lucky that, I'm there with her, and the doctors and nurses are very helpful.
Once we realized, and once the family realized that this patient was nearing the end of her life, our nurse navigators was able to communicate with the family about different options, either having her palliative care at home or the hospital. They were able to meet with the family at the hospital and provide them that support.
I was just so lucky that we moved here 3 years ago. I didn't know about the system. When this program came, to my knowledge, I immediately said, wow, this is great. I could not believe that we have this. I think to all the staff of Senior Home Support System, I am so deeply grateful.
The other part of this is also working with patients and their families. I learned so much about their resilience and the immense love and care that they have for their loved one. They also teach me so much about life and the power of just love and support for an individual that needs it.
If I didn't have any help from you guys, I don't think I'd be able to survive that long. So, thank you.